Dr. Henry, Minister Dix. I wanted to ask, Dr. Henry, you mentioned briefly about breakthrough cases. I notice, if I'm looking at the numbers right, it looks like it's a higher proportion of fully vaccinated people who are now ending up in hospital. I wondered how that might impact your timing and thinking for more widespread boosters.
Yeah, so there's a couple of things around breakthrough cases that we are watching carefully. We know that as more people are immunized, the numbers of breakthrough cases and therefore the percent in a day will go up. But if we look at it in terms of rates, for fully vaccinated people, it's still 50 times lower risk of hospitalization and infection than people who are not yet vaccinated. So it's because it's such a smaller number of people who are not yet vaccinated. In terms of booster doses, we are looking at this, and we started with people who don't mount a strong immune response to their first series, so the first 2 doses. So people on cancer therapy, solid organ transplants, people on dialysis, and we have started that program to provide a 3rd dose to try and get them a boost at all of the primary series, and we started booster doses for our elders and seniors in long-term care. We are looking very actively at, are there other groups where it is important at this point in time to receive a booster dose? And we'll have more to say on that in the coming days, because there is increasing data and evidence that we're reviewing around that. So that would be people, seniors and elders in the community, people who are immunized first, people who are immunized with a shorter interval than others, because we know that longer interval that we've been using has meant longer lasting protection. I will say that for most of us, young, healthy people, that we are still seeing very strong protection from the 2-dose vaccine program that we have here in BC, and that vaccine effectiveness is lasting 6 months, 7 months, 8 months. So we'll have more to say about that soon, but that is one of the things that we're looking at in some detail.
Over to Minister Dix.
Percent of people have received their first dose immunization. 82.9% have been fully vaccinated in BC. That's the vast majority of people. So 82.9% fully vaccinated. An additional 6.1% have received their first dose partially vaccinated, many waiting for their second dose now. There's a delay, there's an interval between the doses. And so obviously that means that the vast majority of people are vaccinated in BC. If you look at the critical care numbers, yesterday there were 153 people in critical care, essentially, in that case, less than 10% of those. In a province where almost 90% of people are fully vaccinated, are represented by fully vaccinated people. So there's a tendency to look at the difference between 16 in one day and 13 in another day. If BC was made up solely of fully vaccinated people, we'd be in a completely different situation. This is a pandemic of the unvaccinated. I want to say to people that if up to now there's a sense that people have either not paid attention or stopped paying attention, COVID-19 is with us, particularly in the north, in a way, in a transmissibility that it hasn't been. And this is the time to get vaccinated. You need to take this seriously. You need to take it seriously for your own health. Someone passed away in their 20s in the north today, and you can imagine how their family is grieving. You need to take care of that for your loved ones, for people in your community, for people in the province. It is time to get vaccinated. There is going to be all kinds of details about the increases amongst those who are fully vaccinated, and there have been, so far, clinically vulnerable and people in long-term care, about 40,000 people who've got a 3rd dose either to complete their course or to get boosted against COVID-19, all of them seriously clinically vulnerable. Those steps are going to be taken. But I would say to everybody, it is time to take this as seriously as you would as if your health was at stake, because it is, because of the ones you love's health is at stake, because it is, and take the actions and the measures that have been put in place today, and the need to get vaccinated with all the seriousness that you would with anything else that threatened the ones you love.